Welcome back to Inside the Issues. I'm Alex Cohen, coming to you from my home in Northeast Los Angeles. There's still a lot we don't know about novel coronavirus, but there are some very important things of which we are certain. Being inside with a lot of other people is something we really should try to avoid at all costs. But due to the high cost of housing, that's practically impossible for many Southern Californians. Reporter Jackie Botts of the project The California Divide has been writing about this as part of a fantastic three-part series that you can find online at calmatters.org. And Jackie joins us now with more. Thank you so much for being with us.
Thanks for having me, Alex.
So we should probably start off here with the basic definition of terms. When we're talking about overcrowding, that can mean different things to different people, but you're working with a pretty clear-cut definition here. Can you tell us what that is?
Yeah, this is the commonly accepted definition of overcrowding, and an overcrowded house, per this definition, is a home, a house or an apartment where there are more people than there are rooms of any type, excluding bathrooms. So to put that into concrete terms, I spoke with a family in San Diego County who lives in National City. A mom, a dad, and two kids, and they live in a one-bedroom home. There are three rooms total. There's a bedroom, a living room, and a kitchen, and four people. So that is the definition of overcrowded homes, more people than there are rooms.
And there are a whole lot of folks who are living in these overcrowded homes. Can you give us, and this is happening all throughout the state, can you kind of walk us through some of the numbers in terms of how many Californians are living in this sort of situation?
This was something that I think was on our radar because as reporters covering poverty and inequality in California for the Cal, we're frequently talking to people who live doubled up, multiple families to a house, parents sleeping with their kids in a single room and a family member in the living room. But wasn't until we started crunching the numbers that we realized just how widespread it is. About 1 in 6 Californians, or a total of 6.3 million people, live in overcrowded houses or apartments in California, where it would be very difficult to isolate from one another per public health guidance.
And if I recall correctly, here in Los Angeles, the rates are even higher, 1 in 5 living in this kind of overcrowded situation. So let's talk specifically about, let's say someone contracts coronavirus, and as we've heard repeatedly from health officials, the best thing you can do is self-isolate and quarantine. How does that line up with people living in situations such as these?
It's really challenging. I spoke to a doctor in Los Angeles, Dr. Efrain Talamantes. It's Dr. Efrain Talamantes. He works with a largely low-income population, and he said that he's kind of stopped telling people to try to isolate in a separate bedroom when that's just not possible for them. Instead, he really emphasizes hand washing and cleanliness. For a lot of people, if for a lot of households, if one member of the home falls ill, they might be able to get a hotel or stay in a separate part of the house. But for these families who live in crowded homes, it's really tough. And it's made worse by the fact that in California, so many of the people who live in overcrowded homes are actually essential workers, people who are coming face to face with people all day as part of their work. We found that about 2/3 of Californians who live in overcrowded homes are essential workers or live with at least one essential worker.
And there's also some breakdowns you were able to do when it comes to the racial demographics of those living in these overcrowded situations. What can you share with us on that front?
Of people who are living in overcrowded homes and at least one member of the home is an essential worker, a full 92% are people of color, with the vast majority being Latino in California.
And when it comes to these individual stories, Jackie, I just found some of them heartbreaking. There was the mother who talked about, living in these close quarters with young children and how her young child crawls on her all the time. I've got a 2-year-old and I think the exact same thought. I don't know how we would possibly even begin to stay apart from each other were one of us to get sick. There was also a gentleman who talked about what he might do if he wound up becoming positive with coronavirus. He said he would go sleep in his car because there was no place else to go. What are some of the health ramifications of people, even if they do try to isolate? I can't imagine that that's the best option for recovery if you're living out of your car.
One of the kind of real big implications of what we learned here is that as people have reduced incomes, don't have jobs or have much more limited hours, people are increasingly looking at downsizing or living in more crowded homes. And so there's certainly a risk that transmission to your family members could become more common as people unable to pay their rent are moving in with family members or moving in with other families. To speak to the health risks that you mentioned, I think the resounding message that I got when I spoke to doctors in different parts of the state in Los Angeles and in San Diego was that what we're seeing that's really common is entire families getting sick.
And it is in some ways, obviously I think as human beings we should be empathetic to anyone falling ill, but there is a bigger kind of picture health perspective on this. It's interesting to watch as this coronavirus pandemic has evolved. Originally, we were seeing some of the highest rates here in Southern California in places like Brentwood, these more affluent areas, but that really had to do with who had access to testing. And your reporting in CalMatters shows that there's really been a very big switch over to the neighborhoods where we're seeing the highest rates of coronavirus. What's kind of the big picture health outlook here as this virus continues to infect these overcrowded situations? Because it seems like there's a very good possibility, considering that they're frontline workers, that it could then come back into these areas where there isn't overcrowding.
We pulled data from late May. We were looking at neighborhoods in 10 counties across California, and we saw this very clear link, right, where the neighborhoods that had more crowded housing also had a higher burden of coronavirus. And I will say that when I checked some of those neighborhoods more recently, the gap between the wealthy and the less wealthy neighborhoods had grown. So I think that you're right to point out that this is dynamic. This is something that in a lot of places is very much increasingly burdening these neighborhoods that have more people experiencing poverty, more people living in crowded housing, more people who are essential workers, more people who don't have insurance. So yeah, this is not something that's going away quickly, right? And especially as we begin to reopen the economy even more, it's important to keep in mind who are the families that are most at risk as we sort of take on more public health risks.
Jackie Botts, you can read her entire report on overcrowding and the implications that this has for the spread of coronavirus at calmatters.org. And be sure to join us here on Inside the Issues every Wednesday when we hear from one of the great reporters at CalMatters. And stay with us because we have got more Inside the Issues coming up after this brief break.